Alrighty guys, so what this video is going to hopefully try and help you out is basically try and mimic the kind of treatment we were doing on the table in the clinic. Now, like I said it before, it's not going to be exactly the same, but this done consistently enough can really help improve everything that we're working on, especially if there's any kind of tightness around the hips, lower back pain, knee pain, just general stiffness around there is going to increase your mobility no end. The more you do this, it's just going to open up tight tissue, get some movement through the muscles, get some blood going through the muscles, and help build strength around other areas as well. So the main goal for this is just to show you what you can do with a simple lacrosse ball. So this can be lacrosse ball, best thing out there. If you don't have lacrosse ball, you can use hockey ball, cricket ball, baseball. Spiky balls are fine. Tennis ball, not ideal, not quite strong enough, because once you see what we're doing, we're going to put a lot of body weight onto it and it's just going to flatten out. Now, if the area is really, really tender and tight, then tennis ball may do, but overall it's not going to get the best results out of it. So ideally, nice hard ball. You can go golf ball, a little bit too small, a bit more pinpoint, but you want, around about this size is best. So what you'll probably notice from whether we're getting in there with your dry needling or just my elbow and thumbs, we're aiming, the main couple of muscles we're aiming for, what we call TFL and glute median max. So TFL, front side of the hip there becomes really, really tight from a lot of sitting down. And you know exactly when I get my elbow onto that, or a big twitch from the, get my head in the spot, big twitch from the needles, kind of gets really, really nasty. Gets very, very tight from lack of glute function, overtakes the glutes work when we're sat down quite a lot, feeds down to the ITB that causes knee pain. So get your ball. Easiest way to find it when you stood up is find your hip bone, go down slightly and outwards to the side. So it's normally where your pocket sits. All right, and the way to get that, get your ball on the ground. Now this can be done against the wall, but I found it a lot easier on the ground because you put a lot more weight on. Find that hip bone, come down slightly, and you just put some pressure on. I've got it there straight away. You will know exactly when you find it because it's going to be pretty shitty. You may get a referral down the leg, that's perfectly fine, but basically just hang out here. All right, find the spot. And what you can do to kind of deepen the pressure in, you're going to try and contract around the ball. So the way to do this, you want to take a slight deep breath in through the nose. So hold your breath and contract into the ball. Hold for about 4 or 5 seconds and then exhale everything. So to show you what we're going to do, so now I'm going to do that about 3 or 4 cycles, and then I'm going to move it a couple of millimeters. Same again, deep breath in, hold and contract, push against the ball, and then exhale and relax. Now you can do that for as long as you want. There's quite a few different spots there. You can move in a millimeter, you're going to feel more spots, but keep going until kind of that tenderness starts to disappear. All right, that should be about 3-4 minutes on one side, go straight to the other side. First one. Second one, we're aiming for both your glute medius and glute maximus. So big butt muscles, pretty hard not to find it with the ball. You're basically just going to sit on it, fish around for those areas again. So I've got a good spot right there, so I'm going to do the same process as before. So I'm going to take deep breath in through the nose. So hold my breath, contract my butt into the ball, hold for 4 or 5 seconds, and relax everything and go. In between your breaths, just take a couple breaths if you need to, and then you can do exactly the same again. So inhale, hold, contract, relax, and go. Now what you can do to add as well, once you find a crappy spot, you can also just move around different positions. So you can put the ball up here. Basically, there's nothing you can do wrong here. Yes, you're going to cause a bit of pain, but you want the pain to be low enough that you can breathe, because we're going to be breathing anyway, and hold a conversation. If it's too damn painful and tender, back it off, because that's just going to cause more detrimental effects. All right, so both sides, TFL, glute, that's all you really need to do a couple of times a day if possible. I've also given most if we've going through the hip series, the hip flex, hip extension, hip rotation, hip abduction, keep going with that, because that is gonna help unlock the mobility as well after doing the ball work. And then all the stability work, the balance work, the single leg work is going to pull all together and give you a big, strong basis to start working from. So ideal routine each day. Get on your ball, good 5, 10, 15 minutes, however long it takes you. Doesn't matter how long, doesn't matter how short. Then go into your 3 movements. So your 3 hip extension, straight into single leg balance, your 90-90 on the ground, into the rotation, and then also the frog stretch at the end, and with your dog legs to the side. Okay, give that a go. All right, let me know if it's not quite working for you. Send a message back if you need to. Otherwise, I'll catch you in the next one. Cheers.